Decatur, local addiction specialists say their experiences correspond to the results of a new national study that compares two drugs used for opioid addiction treatment. The study, published Tuesday in the journal The Lancet, found that a monthly shot of naltrexone, Vivitrol, prevents relapses as well as a daily dose of the drug buprenorphine, Suboxone. Vivitrol can be just as effective as Suboxone if you can get people to go through multiple days of detox first, said Dana Ray, chief medical officer for Crossing Healthcare. But it's not necessarily an option for everyone. Many addiction treatment programs don't offer either medication or only one of them. However, those drugs, along with methadone, are the three opioid treatment options currently available in Decatur. Crossing and Heritage Behavioral Health Center jointly operate an outpatient opioid addiction clinic, which opened at 1029 Ann Water Street in 2016. There, Suboxone and Vivitrol treatments are provided to patients, while Heritage continues to operate a methadone clinic that opened in 1993. Amy Morgeson, Heritage's Director of Substance Abuse and Court Services, said patients are treated with methadone, Vivitrol, or Suboxone based on their needs. While they work differently, each drug blocks the powerful highs created by addictive opioids. Vivitrol requires a patient to fully detox first because, if taken too soon, it can cause severe and sudden withdrawal symptoms. Suboxone can be started sooner, while patients still have mild withdrawal symptoms. For some, Morgeson said, staying away from opioids is easier said than done. It's hard, Morgeson said. I've never seen anything like it. Opioids are just so different. Recently, President Donald Trump declared the opioid crisis a national public health emergency. Overdoses, most involving prescription painkillers and other opioids, killed 64,000 people in the United States last year. Ray said withdrawals are one of the biggest stumbling points for patients who are treating their addictions with Vivitrol. Crossing provides the drug to many of its patients, she said, and it works well for those who complete the detox before taking it. The new study recruited users of heroin and pain pills from 8 detox centers across the United States. Half of its participants were assigned monthly shots of Vivitrol, which contains extended-release naltrexone. The others got daily Suboxone, a buprenorphine naloxone combo in a film that dissolves under the tongue. After 6 months of outpatient treatment, including voluntary counseling, 65% of the Vivitrol group had relapsed compared to 57% of the Suboxone group. Anyone who dropped out of the study was scored as having relapsed. The difference in the groups stemmed almost entirely from patients who left during detox for Vivitrol. 28% dropped out before getting Vivitrol, compared to 6% who dropped out before a first dose of Suboxone. Of those who actually started treatment, about half of both groups relapsed. The researchers found no real difference in overdoses. There were 5 fatal overdoses, 2 in the Vivitrol group and 3 in the Suboxone group. There were 23 non-fatal overdoses, 16 in the Vivitrol group, half of those in the dropouts who never received Vivitrol, and 7 in the Suboxone group. Those preferring Suboxone compare it to insulin for diabetes, but others see it as a crutch because it contains an opioid that has a mild effect on pain and mood. Suboxone costs about $100 a month. Vivitrol costs about $1,000 a month. Methadone was not part of the study. In the U.S., methadone must be given at special clinics. Any doctor can prescribe Vivitrol. Prescribers need special training and a waiver to prescribe Suboxone. Vivitrol offers a tremendous advantage to rural patients who live far from the nearest methadone clinic or trained prescriber, said Dr. Nora Volko, director of the National Institute on Drug Abuse, which sponsored the study. This study removes a barrier, the belief that Vivitrol was not as good a medication, she said. However, to remain sober, Ray said it takes more than just simply taking a medication. To her, the skills that people learn in group and individual counseling sessions are essential. Morgeson agrees. People think Vivitrol is a magical drug, she said. It's really an assisting tool to continue sobriety.